Today we'll be starting from the contraception, and for my part there is a barrier contraception and female sterilization. So what is the difference between types, regarding the types, barrier contraception and tubal ligation? What is the difference between these two? Don't say that barrier is barrier and the sterilization is sterilization, but conceptually, what is the difference between two? Yes, very correct. One is the temporary, another one is the permanent one. So the barrier is temporary contraception, and sterilization is a permanent contraception. Barrier contraception. What do you mean by barrier contraception? Why it is called as barrier? Barrier between something and which works as a contraception. That's the simple meaning. So its name itself should suggest us the mechanism of action. Barrier between what? What is the barrier? Barrier between sperm and ova. Okay. Still better. In fact, a barrier between two genitals. Barrier between the two genitals. So that barrier prevents deposition of sperm inside the vagina. So that prevents the deposition of sperm. That is important. Right? So, is it the same for the male condom and the female condom? But the mechanism of action is the same for male condom and female condom, or it's different? Yes, mechanism of action is same for the both, whether it's a male condom or a female condom. So wherever it is applied, it is preventing deposition of sperm inside the vagina. This is the simply mechanism of action. What do you think? Those barriers, what are the types of barriers? Whether it's a physical, chemical, or what? Whether it's a mechanical or chemical or only mechanical. So the types are both. So those barriers can be mechanical as well as can be chemical also, and then both mixed. Types are, one is the mechanical, chemicals, and the combined. Mechanical, obviously, these are the two condoms, male condom and female condom. Chemical, these are the certain chemicals which are spermicidal. So these are creating a barriers or preventing the deposition of sperm inside the female genital tract. Generally, mechanical methods can be used alone. But chemical methods used alone are very less efficient. So whenever both are combined together, that may increase the efficiency. Male condom, obviously, whenever we say about the condom, it generally we say about the male condom, which is the most commonly used. Condom is the most commonly used contraception all over India. Those condoms are generally made up of some material, the latex material, another one is a polyurethane. What are the Nirod available by the government of India supply? That is of rubber latex. Allergy had been found to those latex, and that's why we prepared another one that is made up of the polyurethane. Difference between these two: polyurethane is a little thinner, latex rubber is a little bit thicker, and allergy has been found more to latex. So the person do have both options, whether to use a latex condom or a polyurethane condom. He can choose it. So condom suitable for whom? So which are the candidates for whom condom is the best option or a better option? Again, For the contraception, we discuss as cafeteria approach. We don't say this is the best and all. We have to explain pros and cons of each contraception to the couple, and then the couple may choose. Okay. Then the couple may choose what is the best for her or herself. Still, certain guidelines, certain advantages and disadvantages we should know. So what do you think? Condom is suitable for whom? Which are the best candidate for whom condom is the best? Barrier methods is the best, especially as you replied as multiple sexual partners, or we can use better word, commercial sexual workers, CSW, right? Commercial sexual workers who are having multiple sexual partners. So here, as the contraception, they also have to think for the STD prevention, and so for those, barrier is the better one. Another one, excluding those CSW for whom condom can be beneficial. So we have to weigh the advantage of, suppose, OC pills with the condom. Advantage of OC pills, advantages of condom with the copper pill, like that. So which couple are more suitable for use of condom? As you said, temporary contraception who had not completed family STDs and all. So all those need some contraception. But how will we differentiate for whom OC pills is better, for whom copper T is better, and for whom barrier is better? What is the special advantage of a condom over OC pills? So now I'm asking you very particular question. One is STD prevention. So actually that had been discussed because CSW, commercial sexual workers who are having multiple sexual partners, for those condom is the best one, right? What is the next indication for whom condom is the better one? No hormonal effects. So those for whom OC pills are contraindicated. OC pills are for those for whom OC pills are contraindicated. Condom are the best one, right? Still one more indication where benefit of condom better than the OC pills. STD patient, already we discussed about that, no? Female's history of thrombosis, yes, obviously for those OC pills are contraindicated. But what is the other indication? Heart, this is also over. What is the other? Yes, 143. Infrequent sexual, yes, right. That's what I am asking you. So if a couple who meets once a month, twice a month, and who are having a sexual intercourse once or twice a month, for them condom is the better one. Because even if she uses OC pills as a contraception, she should have to take OC pills daily, irrespective of sexual intercourse. So on such occasions, condom is the better one who are having infrequent sexual intercourse. That's why I put this question. So suitable for whom? One, for those OC pills and IUCD are contraindicated, who are having infrequent sexual intercourse, who are having multiple sexual partners, obviously who need protection from STDs. For all those, barrier method is the better one. Contraindication of OC pills, as you say, condom doesn't require daily motivation like OC pills. That's correct. What are the contraindication of IUCD where Nirod or condom is having the better option? What is the most important contraindication of IUCD where condom is better one? when we try to compare the different methods, we understand it much better. So try to compare. PID, yes, pelvic inflammatory disease. So for those who are having PID, barrier is the better one, because for them IUCD is contraindicated. So what are the advantages of condom? Obviously, you have to compare it with something else. Then it is the yes, cheap. Yes, it is the cheaper option available. Do you know the cost of OC pills? What is the cost of OC pills? How cheap condom is? These are the typical Viva questions. The moment you say it's cheap, so obviously the next question, how cheap it is? Compare the commercial brands of Nero with the commercial brand of OC pills. Do you know about this? Probably no. So I will tell you, generally, commercial brand of OC pills, like the cheaper one is the Oral L, that cost around 90 rupees per kit, per 1 month pack. At the same time, the compared cost of Nero is around 4 to 5 rupees. So barriers are cheaper than all the other thing. So what is the cheap cost? What else? Someone said easy to use. Yes, easy to use and require no assistance. So tell me the other contraception where we need assistance. Very good. IUCD, because that need assistance, some expertise should insert it. Right? Likewise, Nirod doesn't need any other assistance. What else? What is the other advantage of condom? One you say cheaper, another one is no, easy to use, needs no assistance. Something else? Yes, STD prevention. Prevents STD. Correct? That is very correct. Less side effects. Less means you mean that there are certain side effects. What are the side effects of condom? Minimal side effects. So what are those you mean minimal? Now I will lead the question so that it will be easier. Now tell me the non-contraceptive benefits of condom. Non-contraceptive benefits of condom. Now you are discussing about STDs and PIDs. So a little go ahead of that. Take that link only and go ahead. What can be the other advantages that barrier method is offering to that lady? So what are the complications of STD, PID? Those all will be prevented by condom. So what are those? So those couples who are using condom regularly are protected up to a certain extent from CA cervix. Do you think it logically correct? How condom can prevent CA cervix? What is the cause of CA cervix? Yes, HPV, human papilloma viruses, are the culprit for CA cervix, and HPV is a sexually transmitted virus. And that's why those couples who are using barrier methods are protected up to a certain extent by condom. Right? Due to STD, PIDs are prevented. PID can cause tubal infertility, right? PID can cause ectopic pregnancy, right? And that's why condom are preventing PID. Condoms are preventing tubal infertility. Condom are preventing ectopic pregnancy also. Right? Next, another one thing, if a lady who is suffering from STD, suffering from vaginitis, especially trichomonas vaginalis. Trichomonas vaginalis. What is the treatment for trichomonas vaginitis? The treatment for trichomonas vaginitis. What is the drug of choice for trichomonas vaginitis? What is the antibiotic of choice? What is antibiotic of choice? Metronidazole, correct? Metronidazole. Yes, the antibiotic will work, but we have to prevent it recurrence also. And that's why we ask the couple to use a barrier method till it gets treated completely. Otherwise, just by offering metronidazole to that lady will treat treat the vaginitis part right now. But if her husband is also harboring that organism, she will be coming with repeated infection. So that's why the complete treatment of a trichomonas vaginitis is one, as you say, the metronidazole or tinidazole plus the husband should use barrier method, right? Uh, Tell me one condition where barrier method is used as an additional contraception. Do you think two contraception used at one time? Name some condition where both contraception are used. One is a post vasectomy. Very correct. Why? When the female forgets to take USI pills, that is also correct. But again, that will be emergency contraception. If she forget to take USI pills, obviously she will forget. Okay, she can use a barrier method on that on that time. That is correct. Something else? What is the other condition when a woman using other method need a barrier also? HIV, yes, that is very correct. After IUD-CD implantation, no, it's not right. See, IUCD starts its contraception effect the moment we insert it. You should not get confused this. Let me tell you, IUCD can be used as an emergency contraception also. So no need of use of backup contraception with IUCD. Except, again, there is exception. A woman who is using IUCD need a barrier method at some point when during lactation with copper or you mean lactation method or you are, yes, very correct, loss of thread. If that property location is in doubt, if that property location is in doubt, if that thread is not palpable till it become confirmed that yes, in doubt of exposure, if she is in the doubt that property is there or not, till it's get confirmed, she should use barrier method as a contraception. Again, another one thing someone put as the, if she forget USI pills, she can use a barrier method of contraception. Yes, I mean condom with lactational method, lamb. So if the natural method like lamb, as you say, lactational amenorrhea method, if the natural methods are used with barrier contraception, it will add the efficacy. That's correct. Another one condition, if a woman who come on 7th day of the menses. She come on the 7th day of the menses and she asks she want to use OC pills as a contraception. Can we offer her OC pills now? Generally, when do we start OC pills? Obviously, OC pills is still to be discussed for you, but as you have primary knowledge, basic knowledge, you should know when do we start OC pills. We start as early as day 2 of the menses. Ideally, should be started on the 2nd day of the menses, maximum up to the 5th day of the menses. But if she come after the 5th day, shall we offer her OC pills or shall we ask her to come after the next menses? That's why I asked me if she comes on 7th day, we can offer her OC pills. Then what's the difference if we treat it from the 2nd day and if she come on the 7th day? Still ovulation not occur. You are correct, but the problem is that if we start her OC pills on 7th or 8th day, if she had intercourse on the 8th day or a 9th day, and if she ovulated on 12th day, the sperms are viable. Sperms are viable for 72 to 96 hours, and in some cases, depending on the surrounding environment, sperms can be viable, fertilizable even up to 5th day also. So it has been observed that OC pill should be taken at least for 7 days to prevent the ovulation. And that's why we start it as early as 2 days. I mean the day 2 of the menses. So my point is, if she comes after the 5th day of the menses, still we can offer her OC pills, provided that she should use backup contraception for 1 week or avoid the sexual intercourse for 1 week, because it takes at least 1 week for the OC pills to prevent ovulation. So another name for that is the interim contraception. See, there are the advantages: cheaper, no side effects, easy to carry, simple to use, and disposable. Interim contraception, that's what I mean. Interim contraception, like while taking OC pills, after vasectomy, after the copper T thread has been missing, it can be used. STD protection, protects against the PID, ectopic, tubal infertility, protection against CA service, and this one is the immunological infertility. Immunological infertility means there are certain antibodies against especially the sperms. Whenever there are this is one of the rare cause of infertility where antibodies had been produced against the sperm, and so there is no pregnancy. And so for such couple, we advise to use a condom for at least for 3 months and then test again. What are the disadvantages? So as you say, some of you say side effects. These are like accidental break, slippage of during the coitus. It may cause inadequate sexual pleasure. Some may have allergy to latex. Obviously, both the partners can have the allergies. It can be used at 1 time only, and failure rate is 15, is far more as compared to all other methods. Next, we come to the female sterilization. That is the family planning operation, very commonly known as family planning operation. So, what it means? It means occlusion of the fallopian tubes at some places. We have to occlude the fallopian tubes. Block the fallopian tubes. Both the tubes should be blocked, not only one. So when the female sterilization is carried out, so what are the indications? Like, what is the family planning? So that's the voluntarily the couple is asking for family planning surgery. Another one is the medico surgical or a therapeutic indication. Do you know any therapeutic indication of tubal sterilization as a therapy? What can be a therapeutic indication for tubal sterilization? Therapeutic means prevent or to treat certain conditions. Obviously, it's a preventive surgery. So I will give you some hint. This surgery can be life-saving for that lady. How it can prove to be a life-saving? How a family planning surgery can prove life-saving surgery? Diabetic woman. Okay, something more serious. Diabetic now can be not that much life-threatening, but what I mean, you are on the right track. Hypertension, diabetes, these are very easily treatable nowadays. These are not life-threatening complications or the illnesses. You need to something more serious disease, which can be life-threatening, obviously. Diabetes is not life-threatening. Hypertension is also not life-threatening. So I will give you some name those conditions where pregnancy is contraindicated. And in such conditions, that pregnancy can be dangerous to her life. So what are such conditions? Heart disease. Not only heart disease, you say severe heart disease. Severe heart disease, right? Some severe diseases like critical mitral stenosis, thromboembolism. For those, pregnancy is literally contraindicated. Coarctation of aorta and all. Another one, probably not mentioned in your book, but let me tell. Ectopic pregnancy, okay, but it's not a therapeutic indication. Yeah, that is all. What do you mean? Would you like to explain why you say ectopic pregnancy? I like the answer, but I want what is the logic behind that? I like your thought process, but again, I am interested. What you thought behind that? Ectopic pregnancy. Uterovaginal prolapse. See, tubal ligation preventing all the types of pregnancies, intrauterine as well as ectopic also. But even though if she undergone sterilization surgery, she can get pregnant as a failure, although the rate is very less. But whoever those conceive after the family planning operation, incidence of ectopic pregnancy is more. But that doesn't mean that family planning operation increases the incidence of ectopic. In fact, female sterilization prevent all the type of pregnancies, intrauterine as well as extrauterine. But if you want to say something else, that's why I am asking. Whenever a patient coming with a ectopic pregnancy, and if she had completed the family treatment for ectopic is salpingectomy, then better to do the sterilization surgery on the other tube also, so that next ectopic will also be prevented. So in that sense, you are correct. Someone said uterine prolapse. Yes, because if we are treating her prolapse by some conservative surgery like Fothergill surgery, her uterus, her cervix should not get complicated with the pregnancy, and so she should be offered family planning surgery. She should be offered. It should be seriously thought, but it will not be imposed on the patient. That is the decision of the couple. As a doctor, we should suggest them. A next pregnancy can be dangerous. Right? Another one indication is if a couple who is having hydrosalpinx, if a couple is having mm, infertility due to hydrosalpinx, means tubal factor of infertility. What is the treatment of tubal factor of infertility for the pregnancy? If the female is having tubal factor, tubal block as a cause for infertility, what should be the treatment? How will she conceive? What is the treatment for tubal factor infertility? What is the treatment of choice for tubal factor infertility? What is the treatment for ovulatory factor of infertility? For ovulatory factor, we use them ovulation induction. But for tubal factor, what can we do? Can we offer her another tube? Do we have a facility? Oh yes, remove the block. You are correct, but mechanically, if it's a true block, even if we removed by by the tuboplasty or something, that tubes is not functioning physiologically. Reversal of the block. Yes, if it's a proximal block, that can be treated. But otherwise, if it's a distal block at the fimbria, then it's not treatable. And that's why the answer is IVF, very correct. In IVF, in vitro fertilization. So if we offering her IVF for the tubal factor, especially hydrosalpinx. What do you mean by hydrosalpinx? What do you mean by hydrosalpinx? Hydrosalpinx means collection of fluid inside the fallopian tube, right? And so if we offer her IVF, still few of them doesn't succeed because that fluid from that hydrosalpinx is hostile for that pregnancy. And so that fluid should not enter the uterine cavity. Right? That's why we do ligate the fallopian tubes before the IVF. So this is I will say a contradictory statement, or what you call it. So tubal sterilization can be used as a method for infertility treatment. Hope you understand it. But post fluid removal, but it's not that easy to remove that fluid because it recur again and again. Okay, next let's move. What is the when we can offer her tubal ligation? When we can offer her tubal ligation? Yes, you have seen the case. Yes, the cases had been seen. You are correct. But sporadic cases, which case you had seen? So I mean, this is one of the thought for doing a tubal ligation before IVF, especially those who are having hydrosalpinx. So we can improve the results of IVF. Okay, when we can offer tubal ligation. One is the puerperial, means immediately after the delivery. Then with MTP, simultaneously with the MTP, and another one is interval tubal ligation. What do you mean by interval? Interval means interval between the two menses. So with all those timing, we have to confirm that she is not pregnant. Because if we do the surgery on the pregnant woman, that will be counted as a failure, and that should not happen. That's why we have to take utmost care to choose the patient for a tubal ligation and choose the timing. Puerperial, what is the advantage of this puerperial timing? One, she is already hospitalized. She delivered just now, so obviously we are very sure that she is not pregnant. But the most important advantage is that she is hospitalized still now, and so she is at rest for a few months for the delivery, and in the same rest she can have this surgery also. This is the one benefit. And surgically also it is very easy, because uterus is abdominal organ during the puerperial phase, and that's why it's very easy to take the fallopian tubes out and do the surgery on that. With MTP, obviously we do it under anesthesia. Interval in between the menses, but it should be done after the menses, within the first week after the menses, so that we are very sure that she is not pregnant, she is not in the ovulatory phase. If we do the tubal ligation on day, suppose day 16th day of the menses, and suppose if she had ovulation on 14th day, and if she conceived on that 14th day, we will not be able to know that she is pregnant. That's why we do it after the menses, so that pregnancy will be surely ruled out. What is the technique we use? We use a modified Pomeroy technique. So here we open the abdomen. We go with all those layers. We open the abdomen. We take the fallopian tube, make a loop of that fallopian tubes, and tie it with the chromic catgut number 10, and then we cut that loop, and then the medial end of the fallopian tubes is ligated with non-absorbable suture material, medial end. This is known as a modified Pomeroy technique. This is the technique followed in our hospital. This is a very common question in your viva. What is the name of the method we use for the fallopian? We use for the surgery of the tubal ligation. What is the suture material we use? It is a chromic catgut number 10. Minilaparotomy. What do you mean by minilaparotomy? Means we will be taking a small incision, just incision of 3 centimeter. We do this surgery. That's why it is called as a minilaparotomy. What are the complications of any of the surgery? Yes, these are the bleeding, infection. These are the inherent complication of all the surgeries. Failure rate is very less, just 0.1 to 0.5%. But we have to explain to the couple that even though if we do surgery, this is the failure rate, so that if she missed the period, she should not consider that she is not pregnant, because this is the possibility of the failure. She should be alert. If she missed the period, she should check the pregnancy. Another one is the laparoscopic sterilization. So, Pomeroy technique. This is laparotomy. This is the open techniques. Another one is the laparoscopic sterilization. This is common nowadays. Advantage that it's a daycare, only one suture, so that it's less painful, less hospital stay and all. We use the Cialistic rings to occlude the fallopian tubes. So the advantages are it is less hospital stay, less infection, less complication. What are the disadvantages? Disadvantages, it need special training, it need expertise. So this is in short about the barrier methods and the family planning surgery. Please go through the books to get the more information, and then if you have the doubts, feel free to ask the doubts. Thank you.